YouTube, this is Susan. This is my week 19 vertical sleeve gastrectomy update. This morning I stepped on the scale at 232, so that's 1 pound down for the week. So that's a total of 105 pounds lost. My NSV, I would say, for this week was Sunday. My brother came in to see my dad. My dad's in the hospital right now. But he came in, and I guess this is like the first time I've had a significant loss, and he's finally noticed. I don't know what took so long, but granted, we don't see each other that often. But last time I'd seen him, I think I had lost like 60 or 70 pounds, and nobody even like said a word. So I guess whenever you start out at 337, I guess it takes 100 pounds for somebody to notice. Excuse me. Anyways, so yeah, he called me skinny, which is funny because I still have a long ways to go, and asked me if I didn't mind how I was doing it and the duration of the time, and I told him I started in June, which I did. That's whenever I started my pre-surgery diet. And as far as how, it was kind of funny because my mother chimed in and said she's just been eating protein and vegetables, which is kind of funny. But yeah, I kind of reiterated on that and told him that I was paying attention to what went in my mouth as far as my carbs, what kind of carbs, where I got them from, and making sure I always got plenty of protein in, and anyways, just went from there. But anyway, so that's been what's going on the weight loss end of things. Tomorrow I go in, let's see here, last Friday, sorry, I had to stop and think what day I had it done, but last Friday, my little girl, my 19-month-old, we're having trouble with her actually talking, and so the first order of things to do is have the hearing test, and she had that done on Friday and passed that with flying colors. And so tomorrow I go in for developmental testing for her. So that's what's going on with her there. And then, yes, my father is in the hospital. They had him here in the local hospital. They moved him last night by way of ambulance to another hospital because these doctors here have exhausted all of their resources in trying to find out what's going on with him. All the testing, had blood cultures, finally got those back, and it showed nothing. So they were talking about doing a bone marrow aspiration, but I guess first what they're doing is they took him completely off of the IV, the antibiotics, everything, to see what he would do on his own. And he always starts running a fever about between 12 and 1 o'clock in the afternoon. So what they're going to do is they're going to take blood whenever he is running his fever, and do that, do another CAT scan, do an echo. Well, they already did an echocardiogram, but they're going to do something. My mother said something along the lines of some other kind of echogram. But they go through the mouth on this, and they are going to look at the back of his heart. But honestly, I mean, he had a bilateral knee replacement. That means both knees replaced December 19th. He's just not been the same since. His surgeon even came in, even though he doesn't have any kind of what do they call it, privileges at the hospital he was at, came by and looked at his knees, and there was no fever, no indication. Everything looks good on his knees, so there's no indication that there's an infection there, but there's something going on inside of his body. They have looked at his kidneys, his gallbladder. His gallbladder looks a little bit sluggish, but nothing that would be alarming. They have done so many tests on him, and So now we're hoping, the hospital that they moved him to, it's not the hospital that I wanted him at, but at least that's where his surgeon is, and there's another doctor there that is consulting with 3 other doctors from a nearby metropolitan area to try to figure out what is going on with my father. I know now, since he's been moved and his doctor came in and said, we don't know what to do. We're going to have to move you to where they have like infectious disease, like an infectious disease hospital or something like that. Because they're stumped. Obviously he's got an infection somewhere because he's running a fever. They do not believe he's contagious because it's just something going on from within. I know whenever he had his knee replacement, his blood glucose level drops down to 7.5, 7.5, and whenever it gets to 7 point, that's whenever they give you a blood transfusion. But he was at 7.5, so they did not have to do that. And now his blood glucose numbers are up, right up under the normal. I mean, he's not right at normal, but he's really close to that range. So anyways, if you are a praying people, I would really appreciate your prayers concerning my father, that the doctors can put their heads together, a fresh set of eyes, are looking at his case, to find out what is going on with him so that they know how to treat him. Because every couple of days they were switching antibiotics just to try to find something that would work. It's getting to be quite an ordeal. My father, in just a matter of a few weeks, has lost 50 pounds because, he was getting sick, nauseated. He was throwing up all the time, like every 15 minutes. He was in the bathroom. So I was very thankful whenever they did finally admit him, for nothing more than just to get him on an IV to get him hydrated, because whenever it can be a vicious cycle. Whenever you get dehydrated, that has a tendency to make you even more nauseated. So anyways, they did that. I talked to Mom about seeing, because since his surgery he hadn't been on, he's avid about taking his vitamins, but since his surgery in December he hasn't been taking vitamins, and with him not eating, I was really concerned about vitamin deficiency. So no sooner than what my mom had mentioned that to one of the doctors, within 15 minutes they had him, in addition to his antibiotic and his Protonics and the regular saline that goes in, had a bag of vitamins and kept that going in non-stop. But anyways, so that's what's going on. Trying to stay upbeat and positive, and we know that the doctors right now, they don't know what's going on. Doctors are just people, and even though we as people don't know what's going on, God knows. And I know inevitably he's got it all in control, and I have nothing other to say other than I have to lean on him and just have faith that he's going to take care of the situation. God is a faithful God, and he hasn't failed me yet on anything. I might not always get the answers that I want, but he has never failed me yet. So anyways, again, if you are praying people, I would appreciate your prayers for my father and also for my mother, who is a diabetic. Her numbers are crazy outrageous right now. Funny thing is, whenever you are a caretaker for somebody, you have a tendency to neglect yourself and not tend to yourself like you're supposed to. And being a diabetic, you're supposed to be on a pretty rigid schedule with your foods and your medicine, and my mother's not doing it. Not that she's not wanting to, it's just the way it's going. But anyways, yeah. Thank you for your prayers. But I'm going to get off of here now. I'm right at 10 minutes. Y'all have a wonderful and blessed week, and we'll talk to you later. Bye-bye.